Good afternoon, everyone. Thank you for joining this webinar this afternoon. Welcome to the nursing series. This is part of the nursing series we'll be having. One of the series we'll be having every other time. My name is Sally Chelimo Kane. I work in nursing standards. I'm a senior nursing officer. I would like to thank the Director Nursing, the Director Research Department and Research Team for giving us this opportunity to present the nursing series. Secondly, I would like to thank the Director Nursing and the Nursing Standards Research Department for the opportunity to do the nursing series presentations. Today our presenter is Mr. Njenga. He's a registered nurse working as a team leader in cardiothoracic ward, a BSN, trauma and emergency, cardiac nurse. He has an interest in trauma and emergency. Our topic today is effective communication using SBAR documentation and communication tools. This is a very important topic because it ensures patient safety, continuity of care, and efficient workflow among all the nursing, the medical field. Thank you so much. Welcome, Mr. Njenga. The floor is yours. Let's leave questions and answers. We'll do it at the end. Please chat all the questions in the chat box. We'll be able to answer at the end of the presentation. Thank you.
Thank you very much, Sally. And I want to thank most sincerely all of us who have joined this nursing series. So today we'll be looking at effective communication using SBAR. We'll be looking at what that exactly means.
Recording in progress.
Apologies for that technical glitch. We are back. So let me assist in sharing back the slides, and then we'll be able to continue. Thank you.
All right, we are back. We are sorry for that. So this afternoon, this is the presentation outline. We look at the effective communication. We'll also look at the characteristics of effective communication. We also look at SBAR communication tool. And of course, we will look at the clinical handing over. How do you hand over? Maybe I like starting with a question. What is effective communication? You can interact with us on the chat box, in the question and answer. Yeah, so that we get to know. I can pause there for about half a minute. I get to see what you think effective communication will be. Please interact with us using the question and answer and also the chat box so that we are able to be together. I like my presentation to be interactive. Okay. Can you confirm for me, Sally, whether we've gotten any response? All right. So in the interest of time, allow me to move on. I think there is one chart, you can look at it. What is the person saying?
Saying delivering a message as expected.
For delivering a message as expected. Who is that? I need to know.
Alice.
Thank you, Alice. Thank you, Alice. It's delivering the message as expected. That's profound. That's profound. So then, effective communication. And I see two people have raised their hands. I will give you a chance because I said the presentation today will be interactive. I'll be posing and giving a question time for people to answer. So effective communication is a process of exchanging ideas, thoughts, opinions, knowledge, and data so that the message is received and understood with clarity and purpose. So it's a process. So, and of course, there are ideas that will be exchanged, okay? And of course, thoughts. Maybe you have your own opinion concerning, say, maybe a procedure or how to approach the treatment of a patient. Or there is this new knowledge that probably you feel that you need to communicate. However, now as you are sending this message, it has to be received as you intended, it has to be understood, and it has to be understood with clarity and that it has met the purpose for which that you sent it forth. It also means ideas and concepts that are heard, understood, and people are acting upon them. The message must meet the purpose of the sender. So then at the end of the day, you are able to meet the effect of that communication. So it's effective communication. It has been received and understood. And what you wanted the other person to maybe react, maybe to do, they are able to do as you are intended. Sorry if our internet is fluctuating. Okay. So what are the benefits of effective communication? Of course, one of the things that effective communication does is that it builds trust and credibility. In that, it demonstrates integrity in everything that one does. The other benefit that you get by communicating effectively, that you expect there to be enhanced team productivity. And this enhanced team productivity fosters a culture where team members genuinely engages with one another. I mean, there is that genuine concern of probably the issue at hand, and you want to join hands and ensure that you have engaged, and of course you foster that culture whereby all the members of the team are able to be productive at the end of the day. The other benefit is improved team morale. So members of the team will feel more empowered It gives them a sense of belonging and responsibility. So effective communication is quite beneficial. The other benefit is conflict resolution. So when you use the right communication strategy, you can transform conflict resolution, leading to understanding, reconciliation, and strengthened connections. The other benefit is innovation and creativity, which facilitates generation, validation, and implementation of new ideas. It creates new ways of sharing and connecting with others, quite beneficial. So then those benefits are quite important then when you effectively communicate so that your team has that synergy, so that at the end of the day, you have gained to what you had intended in the first place. So now let's look at characteristics of effective communication. So characteristics of effective communication, of course, there will be clear message. So when you're communicating, you need to be simple. The message has to be simple, easy to understand, and systematically framed to retain its meaningfulness. The other characteristic of an effective communication is correct message. Must not be vague or false in any sense. Ensure that the message that you are sending is true, not false. It must be free from errors and grammatical mistakes. So the message must be complete. Communication is the base for decision making. So then if the information is incomplete, it may lead to wrong decisions. So ensure that your message is complete. Do not send half messages. The other one, your message has to be precise. The message sent must be short and concise to facilitate straightforwardness. All right, so that whatever that you are saying is that it's not so elongated, using so many words to mean very little. So ensure that your message is precise, short, and concise to facilitate straightforward interpretation so that you take the desired steps. The other characteristic is reliability. So reliability is that the sender must be sure from his end that whatever he is conveying is right by his knowledge. All right. Even the receiver must have trust on the sender and can rely on the message sent. So when you're sending this message, you must be sure exactly what it is that you're sending, exactly what you're saying. Of course, there is consideration of the recipients. When you're sending this message, you have to have a consideration to the recipient of that message. So the medium of communication and other physical setting must be planned. You must plan your medium of communication, keeping in mind the attitude, the language that you'll be using, the knowledge. Of course, the people that you're presenting to them, what is their education level? So that you do not speak in abstract, you are speaking clearly. So that you are thinking clearly that this person that I'm sending this message, I want it delivered the way I sent it, so that there is no distortion in the process of you sending your message. And lastly, the other characteristic of effective communication is sender's courtesy. So your message, the message so drafted must reflect the sender's courtesy, because you must show your humility and respect towards the receiver for whom you want the message to pass through. So those are the 7 characteristics. I'm not sure there are 7. The characteristics, there are 7 characteristics of effective communication. So there is that clear message. Your message must be correct. Your message must be complete message. It must be precise, reliable. You are considering the recipient. And of course, you've got to be courteous, even as you're sending this message. Let's now look at the 7 C's of effective communication. So the 7 C's is enumerated there. So the first one is clear. So be clear about the goal and purpose of your message. So before you send this message, you are clear in your mind that this is the purpose for which I want to send this message. So there are times you get messages, you wonder what exactly was being sent. It didn't sound like it was clear. The other thing that you need to do is that you must be concise. Keep to the point. Do not beat about the bush, and keep your message short and simple. Keep your message short and simple so that at the end of the day, you have not confused the recipient more than you have actually moved to actually do whatever you had asked them to do. So your message must be concrete. So concrete, be clear, not fuzzy. Provide detail, but not too much detail. So again, you do not lose your recipient in the details. So be clear in what the message that you're sending. Your message must be correct. Make sure your message is accurate in terms of even grammatical correct. If you're using numerals, ensure that the numbers are matching so that at the end of the day, you are sending a message that is, remember, you want to ensure that your communication is effective so that your recipient may be moved to do exactly what you wanted them to do. So the other thing is being coherent. Make sure your message flows well and laid out logically. So you plan yourself as you share your message. Understand. So everything you're sending is complete. You're not leaving any gray areas. You're sending the message as you intended. Of course, you have to be courteous. Your message should be polite, friendly, professional, and open. These are borrowed slides from Revolution Learning and Development. We thought it is important for us to communicate the 7 C's of effective communication. Very profound, very key. So clear, concise, concrete, correct, coherent, complete, and courteous. 7 C's of effective communication. So at the end of the day, you are sure the message has reached the intended purpose. Good. Now let's look at this effective communication using SBAR. So use of structured communication tools using SBAR, of course, ensures that you have effective communication. Because it has been shown when you use SBAR, which SBAR stands for situation, background, assessment, and recommendation, that it has improved patient safety. So because one, you are looking at the situation, as at where you are, you're looking at the background of the information that you have already done your own assessment, and now you're providing a recommendation, even as you're sending this information. So we look at, we'll break it down so that we're able to understand exactly what is this SBAR and how you can use it to our advantage to effect change and to also ensure that There is that patient safety, and of course, improvement of care as we go moving forward. So let's look at this SBAR or SBAR communication. Now, SBAR or SBAR is widely been recommended as a standardized method of handover of patients. So that you, again, like we said, you have to send the full message. Of course, yeah, we said it has to be concise, it has to be precise, so that at the end of the day, the person that you're handing over, you are not leaving anything to chance. You're ensuring that you have given exactly what you wanted concerning your patient. So this tool is used within primary and secondary healthcare environments to aid patient safety. The National Health Service, of course, in the UK, like our NHIF, is used widely to ensure that these patients are safe even as you're using it. The originality of SBAR, or where it originated from, of course, it was developed by the United States Navy. The intention then was to improve communication among their personnel, and especially the submarines. So that, and of course, those submarines uses nuclear submarines because they wanted to build safety around those submarines. So they came up with SBAR communication. And of course, like all of us are aware, we borrow heavily sometimes as medical fraternity, either from the aviation industry or from the military, so that it helps in the patient safety and in delivery of the care to our patients. So SBAR communication is a standardized method of handing over to ensure that you do not leave anything to chance. Everything has been handed over as you had intended. So SBAR communication is an easy to use structured form of communication because you will not forget those letters of alphabet, SBAR. It's easy, okay? And of course, it is structured so that at the end of the day, you are communicating as you had intended. You're not losing anything that is beneficial to the patient. And of course, it enables this information to be transferred accurately between individuals. And I'm sure sometimes you've been handed over in the course of handing over, and then you're wondering what exactly was being handed over. I mean, there was no structure. And of course, the other thing is because there are some other things that are so important, because the patient information is so important. You want to ensure that nothing has been left out, and especially that is going to enhance the patient care. Also, it allows one to frame conversations in a standardized way. So your conversation is even enriched as you use the SBAR communication. So because you want to ask, how is the situation? Of course, you will ask a question on the area of background, probably on the assessment, what exactly did they see? And probably you can discuss around the recommendation so that you're able to probably arrive at a place whereby you're going to help your patient. So SBAR communication, very important and very vital, even as you care for your patient. Be that as it may then, what is the purpose of the SBAR communication? Because the main purpose of SBAR technique is to improve the effectiveness of communication through standardization of communication process. So because we want, at the end of the day, that we are speaking in one voice. I mean, we are being, the issue here is at the end of the day, we are assessing the patient, assessment-based thinking. So you are looking at a patient after you had assessed them, so that at the end of the day, it informs your care. So then this standardization then improves, like we said, at the end of the day, your communication will be understood, and the person that you're handing over, they will understand what exactly they need to do for this patient. Very important when you're using a structured way of communication. SBAR provides effective and efficient communication, thereby promoting better patient outcomes. So at the end of the day, remember, we want a better patient outcomes, so that when the patient comes, they leave at exact, probably if the disease that had brought them to the hospital, or the deformity, probably, that you want your patient to live better from that hospital that you're in, and go back to their usual self with no complication. Probably if they have gone through rehabilitation, they are going back to their trade, to their usual self. So then when you use SBAR, you will promote their outcomes. Very, very important. So those are two main purposes of using SBAR communication. So then because SBAR is so important, then you want to ensure that you are prepared beforehand as you hand over. Use the tool in order. Do not jump between sections. Give yourself enough time. So for you to prepare, to be able to hand over exactly as you had intended. Write down the information you want to include, and writing down is very key, quite important, because you might, again, you do not want to miss all those important issues that you want to send across to your colleagues. Ensure the environment is appropriate, is free from disruptive noise and distractions as you're handing over, so that you become effective. Like we said, as you're starting, we want to ensure that we are effective. Then we want to break down this SBAR and look at exactly what it is. So situation, you clearly state the following: your full name and designation. You also want to give your current location, ward or department name, depending on the center that you are. You want to give patient details, your full names, and 3 names and age is the recommended practice. Then rationale for handing over information. One, probably like you could say you're concerned about the patient's condition. For example, I am Rhoda Joseph, a nursing officer from Ward 22B, medical ward, and I'm handing over Jill Smith O'Brien, a 51-year-old female. I am concerned about a change of vital signs. So you've already defined your situation, exactly where you are. You have introduced yourself. Of course, with your 3 names, you have given your designation, you have given your current location, you have said you're in Ward 22B, and of course, you have also given the patient's details, their full names, you've given the age of the patient. Very important, so that the other person that you're talking to, you already formed a frame of mind from where they are. So SBAR, the first S, the first letter S stands for situation. So the next is B, which stands for background. So be clear and concise about the patient information that you need to share. Important and relevant for the current situation. Mrs. Smith was admitted yesterday. She has a urinary tract infection and put on augmentin 1.2 grams per oral BD. I want to be quick to say, probably we need to say twice daily. It's important because sometimes you lose some of these abbreviations. So background, you're clear and concise about the patient information. Again, you're not giving so much because again, like we said, it has to be concise, not a very elongated message. Okay, so you've already told them about your background. So A stands for assessment. Clearly states the patient's current condition as well as their normal health status. Latest vital observation, latest set, and the baseline, because again, you want to see if there is a deviation from the normal. For example, Mrs. Smith was alert on admission 1 hour ago with all observations in the normal range except temperature at 37.1. She is now confused. Her observations are blood pressure 90/58 millimeters of mercury, pulse of 140 beats per minute, saturating at 90%, a temperature of 38 degrees, and a respiration of 22 beats per minute. So already you have given your latest observation, your latest set, and the baseline. Okay. You may state what you think the problem is. For example, Mrs. Smith is dyspneic. Okay. And of course, state that you have what you have done for the patient. For instance, I have commenced her on oxygen via non-rebreather mask at 10 liters per minute. So you've already done your situation, you have done your assessment, and you have done something after you have assessment. Remember, at the end of the day, your assessment drives you to care. Okay, informed based assessment that helps you to help your patient. So we have done situation, background, assessment. Now we're looking at recommendation. So be clear in what you want or what you need from the professional that you're handing over to. For example, Mrs. Smith needs to be reviewed in the next 15 minutes. Yeah, because time is of essence. It's important to take notes because again, when you write down, you will basically remember. And of course, those times might need to be countersigned by the doctor after probably you've been given instructions over the phone. Of course, as per the facility protocol. It's very important. So at the end of the day, you have effective communication on your patient. Good. So SBAR, remember, it is the situation. So remember, you're doing an intro. You're giving exactly where you are. You also remember you're giving your three names of the patient and the age and what exactly you've seen. Okay. Background, the assessment, what you've assessed, the baseline, and the current vitals of your patient. And if it need be, you have started intervention on your patient. Then you give a recommendation. You want to be very clear on what you want done by your patient, or for your patient, sorry. And then, of course, it is important that you jot so that at the end of the day, you do not forget exactly what needs to be done for your patient. And again, remember, documentation is key. Using situation, background, assessment, and recommendation, which is very key because you will not miss anything when you use SBAR. It helps in terms of getting to write for your patient. So this is an example on how you can use So you are looking at the situation, of course, like we have talked. You have given your name, your 3 names, your location, then your background, your assessment and recommendation, because very important when you're communicating your patients about your patient. So that's about SBAR. In our introduction, we said we'll also look at patient clinical handover. So remember, effective communication using SBAR: situation, background, assessment, recommendation. It ensures that you have gotten the most important issues concerning your patients, and that we improve their care, and that they will be discharged without any complication or even need of being rehabilitated. So very, very important when you effectively communicate. Good. So now I'll move on to patient clinical handover in the interest of time. So the definition of patient clinical handover is a transfer of professional responsibility and accountability for some or all aspects of care for a patient or group of patients from one healthcare professional to another, or group of professionals on a temporary or permanent basis. It could be probably you're transferring your professional responsibility to maybe another nurse, or could be a nutritionist, could be a physiotherapist, because again, we work in sync, no competition. At the end of the day, the interest is to ensure that your patient improves and goes home back to their state. So that's the definition of patient clinical handover. Okay, so it's an act of communication, because therapeutic communication. Okay, so we want to communicate exactly what needs to be done for your patient. You have done your assessment, you have looked at your situation, you have looked at your background and the recommendations that you have seen on your patient. Critical clinical information is passed or exchanged between health professionals. Yeah, probably you are talking about over deranged vital. Probably you've seen your patient has developed into something that wasn't there in the first place. So it's a critical clinical condition, very important, even as you're handing over between health professionals. And like I said, it could be a doctor, physiotherapist, OT, nutritionist, across board. Effective communication is essential in the provision of safe patient care. So as you're handing over, your communication is effective. So then the issue of writing on the care index of CT care, CTRX, a one-liner kind of in the cardex, or probably as a healthcare giver, when you're handing over to the other healthcare giver, then it might not be effective. Remember to be effective as you're communicating to the other healthcare provider. Ineffective communication has been linked in research to clinical errors, delays in diagnosis, and patient dissatisfaction. That is according to Frame in 2018 of the Royal College of Nursing. So then, like we said, the issue here is we must ensure that the communication is quite effective. Okay, So effective communication then has been linked to all that. So ensure that as you are communicating, if there is a facet concerning a patient that is quite important, you ensure that you have communicated it so that nothing is missed concerning the patient, and that what is beneficial to your patient is clearly handed over. Because again, you do not want there to be any error, okay? Because this ineffective communication at the end of the day might result into clinical error. So some of the indications of patient handover, changing over of shifts, probably came in the morning, probably you're just about to leave your shift either in the midday, or for those who work a 12-hour shift, I want to hand over to the person probably who's taking over for the next 12 hours. Could be a patient referral or transfer. He has been referred, okay? And like we said, you have to be effective as you're communicating. Because again, ineffective communication has been shown to result into clinical errors. So ensure that everything that is needed to be handed over about the patient should be handed over to the other care provider who is taking over the responsibility of this patient. So then, so you want to ensure that the vitals that have been done for the patient have been clearly handed over again. If probably a patient was on a drug that could be interactive with other drugs, you need to ensure that you have handed over. Because again, you do not want another drug that probably has a similar capabilities, qualities to be given to this patient. It might cause other clinical errors. The other indication is during ward rounds, and ward rounds here it could either be a ward round done by the doctors, by the nurses, or by other caregivers as they are giving, as they are doing their rounds concerning the patients. Okay, very key, very important. Of course, the other handing over is clinical assessments. Okay, could be either be emergency or episodic. Yeah, so you have been handed over the patient. Before you take over again, you want to ensure that you have done probably a head to toe examination to see what is happening to your patient. Very important. And then after that, remember you have documented it, and now you want to hand it over after you have done your clinical assessment, so that nothing is left that is going to help your patient. So indication of patient handover, remember, when you're changing over sheets, very important, all patients should be handed over. When patients is being referred or transferred from probably one hospital to another, one ward to another, clear handing over should happen. Or even during ward rounds, what probably happened throughout that shift and what you want the other professional not to miss and to take over, so that you pass on that benefit to the patient. Of course, during clinical assessments, very key and very important, so that what you have picked as you are assessing your patient is clearly given to the next person who is taking over. So types of patient handover. There is that physical handover. Okay, you're physically handing over the patient. This is a Jill, patient in ward 22B. You are physically handing over the patient. And of course, when you're handing over this patient, this is inclusive of what you need the other person to take over from. Okay, the patient is handed over physically. This is the patient, Jill, who is in this ward, bed 7. Yeah, and they physically and they see the patient. Okay. The other type of patient handover is verbal reports. Okay. So I'm imagining probably you are in this center, and probably you are giving over your patient verbally to another person who might either be in your setup or not in your setup. So there is verbal, you're giving something verbal. I remember again, like we said, effective communication has to be clear, has to be concise, has to be precise. Even as you're giving a verbal report, please always remember that you need to be logical and you need to ensure that you have prepared yourself beforehand as you're handing over these verbal reports so that you don't fumble. You're saying something that is clear, that even as you go back to say what you had written, you can clearly remember what has been written. So the other one is written reports. Of course, written reports are clearly written. Like we have said, you can use the situation, background, assessment, and recommendation to actually come up with a clearly written report so that nothing is missed. So that at the end of the day, what was supposed to be done for your patient is actually done. And like we said, nothing is left to chance. At the end of the day, you want your patient to go home without any complication, no comorbidities, so that effective communication brings out all this when you actually give a well-written report. Okay, well-written. Again, and this well-written report, it doesn't have to be a very long report. It is something that is concise, something that is clear, and that is legible, so that at the end of the day, the person reading it is able to understand exactly that you have written. And again, remember, if you have to use an abbreviation, you're using an abbreviation that is internationally recognized, so that the other person reading that report, they're able to understand exactly what it is that you wanted to say for the patient. Then what are the requirements when you are doing a clinical handover? The patient's file, of course, they will have the medical notes, so you're able to refer to these patients, and especially by their free names, and you're able to refer to their inpatient number, very important. Because again, remember that sometimes you have patients who have similar names in our setup. You do not want for there to be a mix-up. The other one is the patient nursing care notes. What exactly has happened? Could be the vital charts, could be the pain charts, the feeding charts. Of course, care index become quite important. The nursing care plan, very important again, so that it informs how you will approach the care of the patient. The treatment sheets, vital observation charts, the fluid chart I mentioned earlier, the pressure area care. Again, you don't want your patient to develop bed sores. Okay. Blood transfusion monitoring chart in case your patient has been transfused over that shift. The other thing is the report book that is well written, yeah, so that it can clearly be retrieved from where it is, and you can quickly go ahead and see what is it that had been written about your patient. The other is a duty allocation register, because again, you want to see the people that will be caring for the patient. And like we said, we're talking about different professionals here. It could be duty allocation register, maybe in a physiotherapy suite. Yeah, it could be maybe in a OT treatment area. Okay, so exactly who needs to do what needs to be clearly out. Of course, the other thing is the instrument register. So you have to hand over the instruments that you'll be using again. And of course, others, depending on the different professions that that would be handing over. So it's across the board to ensure that you have everything that needs, so that at the end of the day you are clearly handing over this patient to the incoming people, so that there is continuity of care to your patient. So the approach, there is an outline in handover working instructions. Okay, of course, it varies by indication. Could be a shift handover or a transfer of patient. Like I said, it could be from one ward to another, from one unit to another, from one hospital to the other. Could be again different professions: nursing, medicine, nutrition, pharmacists. Again, could be different care facilities because of the protocols that attend to that. Okay, different hospitals have different protocols, so you follow as per your protocol. Then remember, at the end of the day, to ensure effective communication is instituted regardless of the approach. Because as you are starting, you said that you want to ensure that the person that you're communicating to is getting exactly what you intended for them to get. So the approach should be, the goal should be to ensure effective communication. Okay. So effective communication is essential in the provision of safe patient care. So you need to explain exactly what you're doing for your patient. Good. We are coming to the tail end of our communication as webinar this afternoon, this evening. So we want to do a summary of what you've been saying for the last nearly 1 hour. So effective communication is essential in the provision of safe patient care. So at the end of the day, we want to ensure that you have a patient who has zero comorbidities, no complication, has been discharged home to his people, or they've gone back to do what they usually do. So back to their trade. Because it is defined as a process of conveying information, ideas, thoughts, feelings from one person or group to another in a clear, concise, and understandable manner. Very important, so that this information that you're conveying it's very clear. It's not vague. There is nothing that has been hidden. The person who has gotten the information, they have clearly been moved to do exactly that you intended, and the continuity of the patient care is never missed because your communication has been effective at the end of the day. And like we said, SBAR is an easy to use structured form of communication, and we have unpacked it to mean a situation. And like I said, in situation, you want to do an introduction of who you are using your 3 names. In our setup, we are talking about the patient. The patient also, you're giving their 3 names and their age and the situation as you are seeing it. Then the background, their diagnosis, what you are seeing then. So you're also giving what exactly you're seeing in your patient. Then you've already done your assessment of your patient. So you've observed your patient, you have done your vitals, you have looked at how they are, will they be deranged? What exactly are you worried about? Okay. And of course, please also remember what needs to be done. It needs to be done. Your patient probably has is desaturating. You might want probably to start them on oxygen supplementation, or exactly what you need to do for your patients in other healthcare professionals. And of course, the recommendation that you want the other person to come and actually give and help. So SBAR, situation, background, and assessment. Assessment and recommendation, very, very important. The structured way that you can easily communicate to different and various people in the health sector. Again, in terms of clinical handover, refers to the transfer of responsibility and pertinent information regarding a patient's care from one healthcare provider to another. Could be during shift change or when transitioning between different care settings. Maybe you're coming from a general ward, you're going to ICU, you come from ICU to HDU, you're coming from HDU, you're going probably to cath lab, from cath lab, maybe you're going to a coronary center, a neuro ICU, all those things, different settings. Of course, it's a critical process in healthcare settings to ensure continuity and safety of patient care. So then whatever you're handing over, the end game, the end result is to ensure continuity and safety of patient care. And like I said, these patients, you want to ensure that, well, as they continue in your healthcare sector, there will be no added morbidity on them, no complication that will happen to your patient. And of course, at the end of the day, they are going back to their centers. They are going back to their homes, to places whereby they can go back to their usual self without the need of being rehabilitated back to the society. Very key and very important. Good. So then, so we have looked at what is effective communication. We have also looked at communication using SBAR, that is situation, background, assessment, and recommendation. We have clearly demonstrated that when you use SBAR, you ensure that there is patient safety, no morbidity, no complication, and at the end of the day, your patient will go back to their usual self, go back to their trade, go back to their families, whole as one, of course, to build our great nation. Very, very important. There is a quote there: the biggest communication problem is we do not listen enough to understand, we listen to reply. Yeah, I don't know who are guilty of that. You know, please let us endeavor to listen to understand, because most of our patients, they are communicating to us, even when they're not so good to us. It's a form of communication. Probably we need to understand from where they're coming from, even before we reply. They could be communicating something, and that is key and important. I love this. Whatever you do, always give 100% unless you're donating blood. So always remember, give your 100% unless you're donating blood. Thank you very much for giving me audience.
Thank you so much for the wonderful presentation, Mr. Njenga. We really appreciated. We learned a lot. There are a few questions if you'd like to answer. One of them is someone is asking, can you classify the clinician's legibility and writing as part of effective communication?
Thank you, Simon Mutua. Like we said, our communication should be quite effective. Probably as we write, we want to ensure that our handwritings are quite legible, so that what you wanted to convey is conveyed nicely and clearly to our patient. At the end of the day, they have communicated. I think the best thing, I do not want to accuse our colleagues. The issue is to ensure that you see clarity of what was not understood.
Thank you for that. Let's talk nursing. Is asking, is physical handing over same as bedside handing over?
It's the same because again, you are it's the same again. You know, again, your patient probably might not be even in a bed. Okay, could be there in a clinic, in a wheelchair. Yeah, partly true. That could be bedside handing over.
Lily Kidai is saying that thanks for the presentation. As alluded earlier, you mentioned that SBAR can be used during handing over for emergency cases, episodic. However, I also feel that the tool can be used in a case-to-case basis, especially for new patients who have been admitted, where we do comprehensive history, physical assessment done, and investigations done, treatment, and then plan of care and comprehensive handing over is done, so that you don't miss on the nitty-gritty information. Please comment on that.
Thank you, Lily. Indeed, SBAR can be used in all those settings that you have said, so that at the end of the day, like I said, nothing is missed. You are not missing anything that you wanted done for your patient.
Thank you. Tony Ocheng is asking the presentation to be shared, and thanks. Kindly note this presentation will be uploaded in our YouTube platform in the KNH forum. You'll find the presentations there. Caroline Kemunto is complimenting. It's a great presentation. Thank you, Caroline. Anonymous attendee is thank you for the emoji. Samuel Ocheng is saying your events are not presented in the PowerPoint. Your events are not present in the portal. I don't know which portal you meant, Samuel. Please clarify. Dorcas Mwendo, kindly share the slides. Dorcas, yes, will share. Anonymous attendees also saying, is there a way to replicate effective communication from healthcare to patients, caregivers to ensure continuity and safety of patients? Please guide.
So anonymous attendees asking whether there is a way to replicate effective communication from healthcare to patients caregiver to ensure continuity and safety of patients. So I'm thinking probably you're talking of the certified nurse assistant. That's what I'm thinking. At the end of the day, you want to ensure that the communication is effective. What exactly do you want them to do? Yes, SBAR can be used in all these settings to ensure that the patient gets the benefit of care, whether you're talking of from the healthcare giver setting or the certified nurse assistant setting.
Another comment from anonymous attendee. I also think feedback is very essential in effective communication.
Very true, very true. At the end of the day, you want to ensure that there will be feedback, as because again, that will show that the communication has moved the other person to do exactly what you intended them to do.
Another comment from anonymous attendee as well. You're a great communicator.
You can see I have emojis. I'm ear to ear, smiling. Thank you for your great comments.
Yes.
Compliment, anonymous attendee. I wish you could tell us your name.
James Nginyani is asking, thanks for a well clarified, it's a comment, thanks for a well clarified presentation. Thank you, James. There's a question also from Paris. What could you say, what could say are the communication gaps from emergency service providers? Please kindly comment on emergency gaps in the service providers.
I think because when you're using the SBAR, I think it is important to ensure that you are giving the situations as they are. A case in point, I am thinking of the pre-hospital care workers. I don't know whether is where you're coming from. Specifically the ambulance, maybe drivers and the crew. Sometimes you just see patients arrive. You have not been pre-informed on their status. So I think it is important for probably the information to get to the hospital of where the patient is going, so that they prepare adequately to receive that particular patient. Thank you.
Osborne Kipto is asking, can this information be used to improve on referral communication? Because we are having challenges with incomplete info and prior communication. Is referring to referral communication, especially maybe on phone or physical. Kindly comment.
Thank you, Osborne. Like I said, as we're starting, we want to ensure that your communication is effective. Of course, SBAR can be used in all those settings to ensure that whether you are thinking of the referral from one hospital to another, or you're thinking from one unit to another, from medicine to surgery, from cath lab, maybe to a coronary center, all those, very important for it. If you used it, it will help in actually the patient care.
Stephen Odeng is giving a comment, so interesting topics. Antana Zomoni is giving a comment. This was a great presentation. Thank you. Andrew Sang is asking if the topic is already in the portal. It will be shared in the course of the day. You'll find it there by the end of the day. Caroline Kenito, good presentation. Mr. Njenga, please explain the challenges faced using SBAR as a method of communication and documentation, and how it is handled.
Thank you, Caroline. Like I said, when we are starting, for it to have effect, is that you have to prepare beforehand. Okay, because here we are talking about communicating either verbally or you are writing it down. When you're using it in that structure way, so that you're not missing any bit, because a situation you're able to explain exactly what you're seeing around. You have looked at the background concerning your patient. Of course, you have used your assessments to see exactly what is happening to your patient in real time. And of course, what exactly after you assess that you need to do for the patient, and then the recommendation that you have. The challenges, of course, would be when it is the other person is hurried, they never took their time to actually prepare to actually write or speak through the SBAR, or of course, maybe having a mental block. So the issue here is just preparing early preparation and writing it down, And of course, practice using SBAR. At the end of the day, it becomes like easy when you're using it.
Comment from Benedict, great presentation and well delivered, bravo. Another comment from a question from Anonymous. We need such sessions regularly to improve patient safety. When can we cover things like NOSCO and assessment tool for children as well? Kindly.
Thank you, anonymous attendee. Yes, I think this week we have been having nursing series so that we address issues to do with nursing. So that whether we are talking about pediatrics, whether we are talking about the adult population, we are able to actually hand and be able to address all the populations in the healthcare setting. So yes, we will in due time, of course, look at how we can present what you have raised. Thank you.
Caroline is also asking, handing over practice is very poor, especially when handing over during night shift. Can we purpose to improve on this?
And like I said, this is it's doable. It's doable when you decide that, like I said when I was talking, that the issue here, the intention here is to improve the patient safety. So when you just write CTRX, CT care, one, there are so many gaps, so many things that we've missed concerning the patient. We have not known on what the patient vitals were, what were the challenges during the day. You cannot just tell us CT care and probably there are things that you did for the patient during the day. Remember, you need to capture everything that you need for the patient. So I think the challenge for us, Caroline, here is to ensure that one, when you are handing over, as a person, that you are handing over exactly how you want the patient to be at the end of the day. Remember, we said is that our SBAR has been shown to improve patient safety and patient care. So effective communication is very key and very important as you handle the patient. So it starts with us. It starts with me, Carol. So I purpose that I want to hand over the patient in totality, not just a snippet of the patient.
There's a comment from Denga. This is a good presentation. At assessment, it keeps changing. How do you communicate that it changes? This is Denga from Eldoret. Thank you, Denga, for joining our webinar.
Thank you, Denga. That's why the importance of documentation. So that you know how the patient started from when you came in the morning at 7:30. That's now some patient would have changed probably say by midday. So it is something that is continuous. Okay. So what has changed over time needs to be it needs to be addressed as it has changed, needs to be documented so that the people you are handing over to are privy to exactly what has happened to the patient, because they could also experience those challenges that probably you have experienced over time when you are caring for the patient. And thank you, Denga, for joining all the way from Washington, D.C.
There's a question from Wilfred Junge. Thanks for the clear presentation. We appreciate. Is there a structured nursing shift handover template at KNH?
Thank you, Infrida Junge. Yes, there is something called handing over work instruction. I think there is also SOP that's supposed to be used. I don't know whether you work in KNH. Probably liaise with your department to see whether you can get that document to be able to read through. Thank you, Infrida, for asking the question.
There's a question from Lucy as well. What technological advancement, if any, KNH has or can use to optimize this framework of documentation given the long hours nurses use in documenting?
Thank you, Lucy. I am just laughing. We are work in progress, and of course, technology. I don't think it will one day overtake our need to do an input, because what you input is what you get as an output. So even when you have technology, whatever you type is what will come out at that other end. So at the end of the day, my take is you need to, even using use of technology, you need to use it wisely and to input what will come out nicely. And at the end of the day, when somebody is reading what you wrote, even in say in that template, is that they are able to make clinical judgment out of it and help the care of the patient.
Thank you. The last comment from Wanyoni. Very brilliant approach to communication. Much appreciated. There's another comment from Lucy. Great presentation. Thank you, Lucy. There is another comment from Jesse. Great presentation. Thank you, Jesse. Anonymous attendees also asked, how can interprofessional barriers be addressed?
That's a good question. I think holding regular meetings, maybe so that you can be able to address the issues. Like I said, the patient belongs to all of us, the doctors and nurses, the OTs, the physios. So I think when you have probably, if you work in a department, you do departmental kind of meetings. It will probably help to improve in the patient care.
There's another comment from anonymous attendee as well. Thank you for mentioning CTRX. This is a real gap that nurses should avoid. Yes, thank you, anonymous, for reminding us. All the nurses, please avoid this. Write it in full or write the treatment the patient is getting. Thank you. Then David Mungai, hello. I was asking whether this is possible to be sending the certificate of participation through emails, trying to reach COC and no list of names received from their side.
Okay, that is has been seen, and okay, that is we will follow through on what you just said. Probably Sally, you'll ensure that people get their CPD points.
Yes, since you've captured your email, we'll send you the CPD points in due course before the end of the week. Nokia 2.4 is giving a comment. Thank you for the presentation. Thank you for joining. Anonymous is also, thank you. That was a good presentation. And thank you. I think we have no more questions, if I may check. Thank you so much for finding time to join us for this webinar this afternoon. We really appreciate it. We've learned a lot on effective communication. Let's continue practicing in our setup and using the knowledge we gained here for care of the patient to reduce patients' medical errors and also improve on the continuity of care of patients. Thank you so much for joining us, and we'll see you again for the nursing series. This is just the startup, and we'll continue this coming next month. Thank you so much.
All right, it's bye for now. Thank you.
Good presentation.